Full house, Mayor, pull up the chair.
And sit back here.
Probably more. Is that one working?
Get this window off.
I'm just gonna turn them on in there. They're already.
Let's go on.
Excellent. I call to order the self-insurance board meeting. Today is May 27th, 10 a.m. Can we have the certification? Mr. Brown, would you be so kind?
Lord, as we come before you at this time, we are mindful of the business of this county and the things that we are trying to accomplish here for the benefit of these civilians and citizens that we have here within this county. Help us to always understand that we ask for your wisdom for are right in your sight. Help us to put aside any agendas that we might have personal that would cloud the judgment. And Lord, we are always trying to keep the citizen foremost in our mind as we work through this. Help us as we continue on our journey. And Lord, we are so grateful for your Son's sacrifice that gave us the hope of eternal salvation. We ask this in your Son's name, Jesus Christ. Amen.
Can I get an approval on the agenda?
So,
We have a second?
Second.
All in favor?
Aye.
Any opposed? We have an agenda. Recognition of the public. Seeing none, we'll move forward. We have approval of the minutes. We could group and approve, or we can take them separately, whatever the.
I'm gonna abstain from the February, but I'm good for April. I wasn't here in February.
Have a motion to group and approve. We get a second?
Second.
Thank you. All in favor?
Aye.
Any opposed? There's a minutes approved. So I would like to just, I should have changed this around when we approved the agenda, but one of the things that we've discussed in the past is moving the consultants up so that they could like present and get back to their other stuff. We've combined our insurance with our liability, and my comments under, comments from the chair are related to liability and risk. And, the financials, I'm trying to get y'all out of here and back to work instead of listening to all of our risk. And if that's okay with you, unless you'd like to say it. If the committee's in favor of that, I'd like to move the consultants up to the top at this point. Okay? Very good. So as far as moving the consultants up, we can go for one-to-one first, and then respecting your time and release you, and then move on. Is that okay? Yes. All right, very good. If you'd like to go ahead. Yes.
So the first handout that you guys have is our clinic stats for the first quarter for our clinic. You can see the clinic visits by month and facility. For the first quarter, your top clinic is going to be the Ellis Clinic. I'm sorry, it's the Portland Clinic. Total text care encounters for Q1 was 387 virtual visits completed. Our overall clinic clinic utilization stands at 74.9. And then for your employee and dependent engagement, overall is 31.4. Top clinic visits for walk-ins, last draws, medication refills, and then total behavioral health visits is 214. And then our patient satisfaction score stands at 98.2.
Can I ask you a question?
Yes, ma'am.
How do you calculate utilization? What are your
It is based on appointments seen, so basically we calculate that to an hour. So an appointment like 2 appointments every hour.
Okay, based on your standard of 1 hour of your appointment. Thank you.
You're welcome. And on the back side of that page is our wellness information where we completed. There were 207 non-compliant employees that did not complete the wellness program. That is just employees, not spouses. Nicotine-free that were non-compliant, 23 employees, 19 spouses. And then 430 are compliant, 184 spouses are compliant. So they went through the health coaching and did all the steps.
So these 184 people, these were prior cigarette smokers or tobacco users of some type? Is that, and now they're not?
Or they may have met all of the requirements to be non-compliant. It doesn't have to be just for nicotine. And that's just your spouse, it's 184.
Is that on top of the 430 or is it out of the 430?
Plus the 430.
Plus the 430, okay.
Is this determined by blood draw or something like that?
The nicotine, yes, sir. But there's a set of benchmarks, and if you flip to the next page, that gives the benchmark. So it's based on their A1C.
I know.
Oh, okay.
I just want to
Yes,
know how
but it
it
is.
figured out their compliance.
Yeah. And they actually have to retest negative for the nicotine. And then the next is the dates for this year's HRA and annual physicals. So we'll start those July 1st, and they will be completed by September 30th. And then the health coaching has to be completed by March 27th. And then we also have set HRA dates of the week of August 11th through the 15th. And that is on the other side, and that is all at government facilities. So admin building, sheriff's office, EMS, highway, and then we'll do one at our Ellis clinic. For those people that want to come just to an HRA event instead of going for their annual physical. Any questions?
I have a question.
Yes, sir.
Back. Do you all have some kind of measurement that you go by to determine whether a clinic is viable or not? Do you make any recommendation to us on whether a clinic is viable? I'm looking here, and not that I want to punish Westmoreland in any way, because that's a very special community, I think. But if there could be some kind of combination, if something might be thought about, it's an awfully low number. How much service is given to that clinic?
The Westmoreland and the White House Clinic, the Westmoreland Clinic is only open 2.5 days a week, and the White House Clinic is only open 2 half days. Several of the survey comments that we get, they would like to see those locations open more, but I think they're not open, so it's not utilized like the other 3 that are open 6 days a week.
And how many people service those areas?
So I'll have one nurse practitioner, physician's assistant, and then 1 medical assistant staff.
And what is a non-walk-in and a walk-in? How are they being serviced, non-walk-in?
So a non-walk-in is a scheduled visit. We have set walk-in hours on certain days at every location, and you walk in, you can come in. Basically, it's an acute sick visit. And then everything else is a scheduled visit. However, if anybody walks in, even if it's not during walk-in hours, we encourage our staff to accommodate all patients.
Were these clinics established at the direction of this board or at the recommendation of your group?
So I will say too, just to remember that this is a shared contract between the Board of Education
I
and government,
understand.
and you're only seeing your numbers, right? So you don't see the Board of Education's visits at those clinics. But that total utilization down the bottom is the combine of both groups. So that 74.9% total utilization, our benchmark for our clinics is 80%. when we're reaching 80% utilization, we're really getting to the max ability that we have to see patients. The other 20% of time that's not patient-facing would be to review lab results or imaging results, check on referrals, things like that. So to kind of answer your question, our benchmark of knowing whether we're successful is being close to that 80% mark. However, when we get close to it, that's when we need to start looking at, do we need to increase hours, do we need to expand availability?
Explain to me what is the cooperative agreement between the board and this board in operation of these clinics?
So it's a split of charges. So it's
A split of what?
Charges. So all of your invoices every month get split between the Board of Education and the government. Pretty sure it's 74/16, 84/16. There's a percentage of charges that are split out between the two groups, and it's based on the number of employees. I think that's how it was set up from the very beginning. So basically, we take the total charges and split those between the two groups. Now, I will say there have been some services that the Board of Education has added, or some services that you all have added, like mail order drugs, for example. Board of Education doesn't do that, you all do. Those charges are just specifically to you. But general charges like staffing, supplies, those kind of things are split out each month.
And who awards contracts? Us or the Board of Education?
Both. We have two independent contracts. We have a contract with you all and with the Board of Education.
We're just sharing facilities.
That's right.
Okay.
And I will say, probably a year and a half ago, we were asked to present only your numbers. So that's why you only see your numbers. If you ever want to see combined, we can do that as well. But that was a request of this committee, which we.
I don't know how everyone else feels, but I'd like to see, maybe like you have here. For us, I'd like to see what
A combined version.
combined
If
looks
you could
like.
just say, split it, have a slash. That'd be helpful to see that too.
How many of these clinics, this is my final question, I promise.
Sure.
How many of these clinics are within facilities owned by the Board of Education?
All of them. Yes.
All of them?
We used to have a clinic that was separate, with the Hunt Club in Gallatin, but when that clinic closed, we moved to Ellis, and we also closed the clinic that was in the DMV building, in Hendersonville, at the same time, and that all moved to the Ellis clinic.
So I have a question, related to some of the things that Mr. Hines asked you. Originally you said that the numbers were set up with the 84/16 split. And how long ago was that? Because maybe and I assume that's based on our total employees that are on board opposed to the ones that are insured, because that's different, right? Or the ones that are using, or I guess it would be our total eligible. How long ago was that created? 2 decades ago? A decade? I have no idea. When did we look at those numbers?
So I did look at them a couple of years ago, and actually you all should be paying a little bit more, based on your total employees and their total employees, but nothing has ever been raised to shore that up. And now to answer your question, how far back, I'm not sure, because there were clinics in existence before one-to-one took over, so I'm guessing that's probably even from like legacy clinic days, and I'm not really sure, but, I know it's been at least 8 years.
And Mr. Law Director, would that have been what we call a handshake agreement that we made with the school board, or do you think we actually had a legal document?
I have no knowledge of anything other than split.
There's contracts. We've had contracts when we had, one-to-one also, when we had, care here. We had contracts with care here and contracts when we had one-to-one, so they've all been contractual. But the percentage, I believe, at the time was based on the number of eligible employees from the schools and the county.
And the percentage doesn't matter. It all comes from the same taxpayer pool of money. It's just, I was just curious also. Thank you. You have a presentation on the bariatric surgery. I want to just let the rest of the board know. We we had a conversation regarding a current, procedures and stuff, and that's removed from today's discussion. Some other avenues have been found for that, but I'd like us to still hear what one-to-one has. We'd asked them to put us a presentation together for the bariatric, thank you, surgery program. Currently, as we, looked at it a couple months ago, we have, tell me, a few people in the program right now, but as we've all discussed through the various meetings, our outline for what's included in our program and how it actually works needs a lot of work. So we asked them last time to just put together one way of looking at it, of a possibility, because it doesn't seem to be working really well at the time. You feel all okay with them presenting?
Okay, perfect. So you've got two different documents, but we'll start with the bariatric surgery program. So based on the last committee meeting, we were tasked to go out and talk to some of the bariatric surgeons in the community and figure out if we could do a contracted rate with them, which we were able to connect with a couple different groups, and they were willing to do a contracted rate with either directly with us or with you all. But essentially, from my understanding, what's happening is employees are filling out the requirements, getting approval to go through the process, but then when they get really close to the end, they're being hit with, oh, this is going to cost you $70,000. And of course, I think you guys have in your documents that you pay maybe like up to $18,000 of it. So I'm not sure in the 8 years that we've been kind of managing this program and making sure the boxes are being checked if anyone has actually really followed through with the procedure because of the cost. So some of the highlights of the criteria, the waiver that you guys have in place is that the employee has to be an employee of 5 continuous years within the county. Again, you pay 90% of the procedure or up to a maximum of $18,000. And then once the waiver is approved by this group, then it's good for 1 year. So that's kind of current process. And there's lots of different boxes the employee has to check beforehand. They have to meet with a dietitian, I think a psychologist. There's several different requirements that they have to do before they even get to the place that they can have surgery. So in meeting with some of the different surgeons around, we found that we can get much more cost-effective direct pricing. There's a doctor here in, I think he's in Gallatin. Yeah, he's out of Hendersonville. He will do the bariatric surgery on a self-pay rate, and he gave us a couple of different options. There's a flat rate for I think the sleeve maybe, and then a flat rate for, the surgery. So if you're looking at these pages aren't numbered, I'm sorry, but it's these gray diagrams. You'll see the different types of surgeries listed in the left, and then the costs kind of break out. So you're looking at surgeries between $14,000 and $20,000, and pretty much everything is included in these prices except for anesthesia. They're generally not included. And then most of these surgeries estimate a one-night stay. It's $600 per night to stay, and that's not included in the cost because they aren't totally sure the number of nights that the employee would stay. But that kind of gives you an idea of the services and the pricing that they quoted, which again includes hospital charges, not the stay itself, testing, surgical procedure, lab, pharmacy, that kind of thing, but does not include anesthesia in some of these. And then there was another doctor, Dr. Reed. He's on the back. He is in Gallatin. And his self-pay rate was $14,000 for the sleeve, just over $14,000, and then $22,000 for gastric bypass. If I remember correctly, Dr. Hannah provided more of the pre-op things in his, so meeting with the dietitian, meeting with the psychologist, all of those things were included in his price, where I don't think Dr. Reed included that. That was a separate price. But there is option to direct contract with these groups, and I will say that it's very eager to do so. But do think that that potentially opens up, more folks entering this program for you all if they're not hit with very large sums of money after. And then the other caveat I would say to this is just for the procedure itself. So anything that could potentially go wrong or, any type of adverse situations that come after this procedure, that would be on the patient, and could potentially hit the medical plan. Depending on how it's coded, you may or may not realize it's a result from surgery. So you could get hit with it, additional things down the road. And then before I stop talking, and I will stop talking soon, I'm sorry, you can ask me any questions. There is a second document that I've included. It's a weight loss program that we're currently running at several of our clinics. And so this is medication weight loss program. It directly targets the GLP-1, but also other weight loss medications as well. And so this program could be a potential option for you guys and might be more cost effective, but also have better outcomes for your patients because it doesn't require surgery. So this weight loss program is kind of similar to the bariatric program in that there are certain requirements the patient has to even be considered for the program. They have to have a BMI greater than 30. They have to log their meals and exercise for 3 months leading up to entry into the program or meeting with a provider. They'll meet with a health coach during that time who will help them with diet and exercise and all of those things. And then they have to lose a certain percentage of body weight, which you all can help determine what that looks like for your employees. So we essentially want to know that people are invested in their health and are able to lose weight before they enter this program, because the goal would be you take the medicine for short term, you're able to lose your weight, get to your goal weight, and then come off the medicine. So we don't want to just start somebody on medicine and not help them have the tools in their tool belt to continue that weight loss when they come off.
The amount that you have here on the third page, is that copay or is that what the program pays?
That's the cost and the medication. And so we can talk about how we want the program to be structured, or like what you all would pay versus what you would want the employee to pay. But that's our cost for the medication. So essentially, after the person has gone through this 3-month process of actually losing weight, meeting with a health coach dietitian, making these requirements, then they would meet with a provider who would determine what medication is most appropriate. Some people cannot take a GLP-1 because of certain things in their history. If they have colon issues, different things, they don't qualify for a GLP-1. Some folks can't take phentermine or some of the other less expensive weight loss drugs, maybe because they have a heart condition. So they would meet with a provider and they would help determine what the right path is for medication weight loss. And I will say we've had some patients who've done this at other clinics who have lost weight in that 3 months, and they're like, man, I can do this on my own. I don't even want medication. I want to continue down this path of meeting with a health coach and doing this on my own. So then once they get on that plan with the provider, they sign a contract too. There's a sample contract here for you to take a look at. But basically the patient knows right up front going into this, hey, these are the requirements of the program. These are the things you have to do, and monthly you have to continue to meet with the provider and with the health coach to make sure you're meeting your targets and you're actually losing weight and doing the things we expect to be able to continue to receive the medications because they can be costly. And then that last page does kind of outline the portion of cost for the medicine. And so, we would recommend that the patients do have some skin in the game with this as far as cost goes. So we would recommend the patients pay 25% of that cost. And then again, we would say consider maybe making this open to people again who have 5 years or more with the county, kind of similar to the bariatric program. Okay, I'll stop now.
I do want to add to what she just said about the 25%. That does not come through or into the out-of-pocket maximum. This is external to the health plan, so just know that does not feed into that bucket.
The lawyer may want to weigh in on this, but in your experience, if a group like this decides to direct patients to a doctor for this procedure, are we in any way liable for anything that doctor does incorrectly?
Yeah, I would love for the attorney's opinion on that. I think from my perspective, these are some of the options you have. They can go anywhere they want, right? They're probably not going to get the price, contract, but it's not, we're saying you have to go here. It's like, these are the benefits. You can still, allow that $18,000 or up to 90% wherever they go. It's just they're probably not gonna get that direct pricing everywhere.
There's always potential for liability, so I won't say we're gonna completely insulate ourselves from this, but I would like to open up with, of all the businesses I've worked with and stuff, this coverage is an anomaly. So I'm very surprised that we do this anyway. But if we're going to do this and go down this path and start setting up doctors and making recommendations on where to go, every step we take to push this program a step further is an extra step of liability we throw ourselves into. So my position would be, if you have a policy now, stick with the policy now, and have either people comply with the policy. If they find it cheaper, then it's probably cheaper for them as well on any payout side. Let them go that direction, and then they just pay it out of pocket. But as far as the policy we have now and how we need to proceed in this in the future, I think we need to hold tight and firm on that policy and not start taking steps into facilitating extra coverage, extra options, extra financial implications as far as what we can cover or not cover. So I don't know where the county ultimately wants to go with this kind of coverage, but that's where I see us heading.
And you may want to recall the Blue Cross Blue Shield rep told the committee a couple of months back that 95% of policies do not cover this for a reason.
And if I'll add, I did a little research, and Cam2 does not cover this for non-diabetic, and it's not covered by our state Medicaid.
So it's something that's rarely covered that the committee's covering. It's quite costly.
We were told that back when we first did this, and as I've said before, I was probably on the old board, the champion of providing this. I don't know why, but I know that people struggle with this sort of issue. And, if it makes them a more effective employee, and we don't have that many, I don't think. But my question would be, from what the lawyer said, if we stayed where we are and didn't do anything else, would we still be okay with requiring some weight loss programs before they do medical?
I don't know what the screening process was prior to this, so what are we currently doing?
It is on, I think, the second page, kind of small, but my understanding is they fill out the waiver, the board approves it, this board approves that they can have the procedure done, and then they start going through all of these requirements, which are meeting with a health coach, meeting with a psychologist, all of those things. And then once they've completed all of these different things, they're able to move forward with the surgery. But I think what's happening is the employees are moving through all of these things and doing that and not figuring out the cost of the surgery is maybe $70,000 or $80,000 total until very close to the end. And then they're frustrated that they've done all of this and they can't afford the surgery in the end.
I think with the county starting to do direct pay, you're going to set a very bad precedent. You've got a policy, they came to it now that some of these providers are asking for direct pay. That's why we pay Blue Cross Blue Shield to actually process these back through your insurance. And also the same, think about other procedures that come in here. Somebody needs an eye surgery, they come back and say it's going to cost them this much, they can come back and direct pay, it's cheaper. You've really set a precedent for all kinds of things if you're not careful.
I agree, and I didn't realize we were going to go down this road, but that is Pandora's box. This doesn't become about the county providing health care, it becomes about the county helping you financially manage what procedures you want to do and not do. And we do not need to be in that business. We either provide health care, they figure it out, or we will be catering to everybody's needs based on financial
And we have had
restrictions.
participants go through the old plan, with Blue Cross Blue Shield paying it. They pay it through the, in-network, because that's what it says on our plan, but we have had participants do that in the last bid. We have verified Blue Cross Blue Shield did process them. But the same thing when I talk to our representative, the same concern comes up. If they have a complication, it's really hard for us to tell what the complication's for, so 2 months later they have an infection or something come up, it's more than likely going to be covered under your medical. You're saying it's only 90% or 18,000, that's potentially going to be more.
So we have insurance to manage risk.
No,
Okay,
please.
the whole reason that we have health insurance really is to manage the risk to the county, to take care of people's health. So it is really hard for Blue Cross to know if someone goes for a post-op visit of whatever sort. If it does not get coded correctly, it could hit you. There are lots of complications that can happen. This is a major surgery, which is part of the pre-work when you're getting ready for the surgery. They're telling you over and over, we are redesigning your intestines, literally. And so it is very important. You have to eat totally differently. You have to make sure your calories are good calories, that you're getting the appropriate amount. You're not drinking too much. You can't even eat and drink at the same time after the surgery, okay? Just people don't know that unless you know someone who's gone through the surgery. It is severe. And the other thing is that sometimes years down the road, they end up in the exact same situation that was presented in the first place. The weight is gained back. And so you, by covering it, I mean, that risk is what my concern is always. You can cover what you want to cover. Legally, per healthcare legal, you don't have to cover weight loss at all. So I just worry about the risk after. That's where my concern falls. Reference-based pricing is actually a very normal thing nowadays, but we don't have to get into that. Many folks are going reference-based pricing for everything, which is what they did. They found that network. It's the same thing as saying you can go to a Blue Cross doctor. You're telling people they have to go to an in-network doctor. So you're already basically directing people where to get their health care. So that is what a network is. But this is taking it a step further, and we are not controlling the risk on the other end. That is my concern about
And she
the
brings up
program.
a good point, because if we direct them to people that aren't in the plan, there's complications, then they're trying to get the complications covered under Blue Cross Blue Shield,
Yep.
they'll deny it.
So what I'm
Or they won't,
hearing
and you
is
get the
that
big bill.
probably what we're doing right now is the least risky situation for this. That's saying we will pay up to 18,000 wherever you find the doctor or whatever you want to do.
No, I think covering it is actually still really risky.
Yeah.
I think you're still in a risk bucket. I think we just have now been hit with this one individual who had the issues with the out-of-network, and so now you're just now discussing it.
Yeah, I think that, and if I can step on all of these conversations, that is what I've been seeing, is the current policy we have does not have, one, clear guidelines on what the procedure is. We've went around and around for months on what's included. And then we've looked at, well, we don't even know what's included because of the things that happen after the fact that come in under our medical plan. So we don't even really know what we are covering now. Our policy, again, that we have, it's not clearly stated what they should do, what the outcome is going to be, how much it's going to cost. And this has only came up because we've had some employees that have went through and to utilize this benefit. But in my view, and I'm going to ask for a motion to discuss, like, the current policy, in my view, is not working because of the risk we have, the lack of definition, lack of a policy. So that's one thing I see. Two, we have other options that are bigger conversations that we need to talk about. In the past, we've heard about the history of the insurance fund being bankrupt, basically empty. And this is one way we can empty it and have to go back to budget for replenishment of our insurance fund, basically. So we have a second issue with what do we want to do with surgery going forward or medication. So those are the items that we have before us today, as I see them. I welcome you guys' views.
I'll make a motion
I think some work needs to be done, I agree with that. We have a board of 5 people. If you'd like to narrow it to 2.
For efficiency's sake only, you're talking about what we wanna do as guidelines and that sort of thing. I would see that as a real tedious thing for, well, it's actually 6 people, I think the mayor is actually, but 6 people. And, I think you could get a lot more done.
Those 6 people, as I understand it, and I want to ask our benefits person, they're in the pipeline for what we have on the books right now. We're not making any changes to them, to those 6 people. Is it 6?
3. It's 3. We have 3 that are working or ready to have surgery.
And those folks are in the current procedures that we have, however we have them, and we're going to help them along. So what I want to discuss is the future and who comes in behind them.
We're actually having trouble with the way it's set up, so.
Yeah.
As I'm saying, if you do it with direct pay, and I agree with our attorney, you're opening Pandora's box, because it's gonna be in for other procedures. And one thing to recall, there's a reason that 95% of the policies don't cover this.
I'm in complete agreement. I would never advocate for direct pay. And I regret that our Blue Cross representative isn't here today to tell us how it goes through our contracted procedures.
It does, but in the past, it's went through as it goes through as as in-network, but the cost in networks, my understanding, it's around $70,000 or something, yeah.
And they manually process them. So if it's something that has to do with this surgery specifically, they're gone through and they're manually processed so that we don't pay any extra. But anything that comes in after the fact that isn't coded specifically to it, it's gonna go through normal.
And you're gonna end up paying for antibiotics, you're gonna end up paying for all kinds of things. If it's allowed under Blue Cross, more than likely it's not gonna be coded to this and they're just getting paid for. Additionally, what they pay for that 10% is not going toward.
I understand.
Is not going toward, or it is, I'm sorry, it is going toward deductible out of pocket or not.
Going towards deductible and out of pocket, but
So they're getting a benefit there
because
too.
it's manually done, it doesn't stop when it reaches the out of pocket for this specific procedure.
But it'll bring them to
It'll be billed to the.
but it can bring you to your deductible out of pocket max. So if somebody does it July 1, that amount's gonna go to their out of pocket max and their deductible, so they're gonna get that benefit. They're gonna get their deductible automatically. So you are paying that.
Mr. Brown?
Okay, I've got 2 questions. First of all, we know that we've got one that has requested bariatric surgery.
We have 2.
2 now.
2 that have already completed and are waiting for surgery, 1 who's just started the
And
program.
you say there's 4 more?
There's just 3.
Six?
There's
Just
just 3.
Well, what were these 6 that you were talking about? Are they just in a weight loss program?
We had that go wrong.
She mentioned 6, I think it's 6 people on the board. That's
Oh,
what she was
okay,
saying,
that's
yeah.
what you meant. Okay.
No, I think I was.
There's 7 on the
Okay,
board.
so there's 2 now in the pipeline for bariatric surgery. Is it, how many are on the weight loss program?
We don't have the weight loss program
We
set up
don't
yet.
have that, oh, okay.
No, that was just an option.
That was
Yeah, for something else to consider. These medications weren't available years ago when this bariatric surgery was presented, right? But now there's some newer things that maybe make more sense, so just an option.
With your, motion, Mr. Hyde,
No, I'm withdrawing my motion. I think what I'm hearing here is that maybe we need to get out of the business altogether.
That's what
I hate that. I would like to have some other kind of option. And having been on this, board when it first started, many years ago, I know that it serves a good purpose and it's looking out for our employees. But I do know that there are limitations on what we can do, and perhaps a good weight loss program would be an option. But maybe we need to get out of the business.
Okay, the 2 that we have, we're obligated right now to see them through it? No, we're not.
You only
2
if
that are
they're,
signed up on.
only if they're following your existing policy. What they've asked for, one of them, I believe with their surgeons asked for a direct pay. We have never done a direct pay before. It's always been through Blue Cross Blue Shield and the network. So that's my question. Yes, you're obligated, but you're obligated based on the way the plan's currently structured.
Right, we don't have to make changes, but we have already agreed that they can complete the program.
Based on the way it's designed, but this.
But after this, we
don't have
shut it down.
We don't have any others, I have had others inquire about it, but they don't meet the, requirements yet. They haven't been with us long enough, so they haven't gotten any of the information. So these three are the only ones that I'm currently worried about. Yes. I would like to say the weight loss program that one-to-one mentioned would be, I believe, just from the employees that I've spoken to, very beneficial, especially if we decide to go away from the bariatric surgery. Many of them have mentioned wanting other programs that they can do. They don't necessarily want the surgery, they just want help. A lot of them do mention medicines, but I think making them put more skin in the game and doing the weight loss and all of that before they get the medicine would be very helpful.
This shows a determination.
Right.
So, if I may,
Mr. Shupin, he's been patient.
oh, okay.
I'd like to hear what the attorney has to say.
I just want to be clear, you all when you presented this said we do not do this now, correct?
Correct.
Okay. So that's something this board, I'm assuming, would have to vote on to implement. And I don't think this is, it's an all or nothing deal. I think that there could be some sort of resolution if you decide to get out of the surgery business aspect of this and implement this. I agree with everything she just said. That seems to be what I hear as well. They want help, not necessarily surgery. So I'm just throwing that out there as a possible modification to any motion that may come up.
I just want, it's been implicated here, but just want to state, if you do make a motion to terminate that program, I think the simplest thing to do is include in that motion that those who, as of the date this motion passes, be grandfathered if they follow the program that you have. So you'll have to work on the wording.
Well, I think from a legal aspect, that's not even an option. We have to. Anybody that's in an effective date of that motion, then they're going to be covered, at least if they follow the current policy in play right now. But yes, to his point, you can make that part of the motion.
We can make that a plan amendment. That can happen.
I'll go ahead and make a motion then that we adopt the weight loss program and do get out of this bariatric surgery with those three that are going to be grandfathered.
I would not want to combine the two items.
You don't want them.
I see them as two different.
You need to discuss the details.
We
You may need to discuss the details of the
Yeah,
weight loss
there's a lot
program.
more details in this weight loss that we would probably need to, because one, and if I can discuss, one thing is, once we start a program, this is a per month cost, and there's no definite end date. We only have a set amount of money in our insurance plan.
Okay, well then
I just want you to look at the unending cost.
Or employees coverage, because they need some skin in the game, or it'll be much less likely they're going to be successful. You think a lot of people may join that, spend $1,000 a month and diet and exercise, drop out in 3 months with no success, but if they've also paid $750 of their cash, they're much less likely to drop it. If you make them pay 25%, they're very unlikely to do that. So, less likely.
So there's more thought, I think, to be, I like the weight loss program, but I would think that we would need to have more than a half an hour of discussing for such a significant cost.
I'll restate again. We get out of the bariatric surgery program, that's my motion, with the three that are already in the system.
I would second that due to our current policy issues, and I don't think that I've looked at our policy to try and make it work. It would be an overhaul. It doesn't have, to me, I can't figure out what guidelines you need to make and where you need to go. And then with the new, cost barrier that's come up in recent months, I don't see it as feasible. So we have a motion and a second. More discussion?
Can I get clarification on the motion? Does the motion mean they have to complete it as currently designed? No direct payments or any modifications?
Mr. Smith, Mr. Hyde?
All right, answered my questions, so.
So all in favor? Aye. All opposed?
I'm just going to pass. I'm conflicted. I need to think about this a whole lot more.
Okay. So the motion passes. I'd like to ensure that in upcoming, at our next meeting, we all get educated on the weight loss program and be, more able to discuss what costs and how that would look. And if finance could give us a look at that, that would be helpful.
About how to design it?
How to design it, what kind of costs we would be looking at.
The problem you've got, we don't know how long it's gonna run or which medicine's gonna
If you
use.
could come back to the table with that next month, that'd be helpful.
And that's something that one-to-one can get with us on.
We can run some numbers.
Is there any way we could put goals on this program, and if they don't meet the goals, then they drop out of the
Yeah, we
program?
do. We actually set goals at the beginning, and they have to continue to lose weight to stay on the medicine, right? So if you go more than 2 months stagnant with no weight loss, then obviously you're not eating right, you're not exercising, you're not doing those things. We stay in that agreement with them. We're gonna discontinue.
And the question,
Guardrails.
then the question comes about at that point, we have a wellness program already with BMI requirements that you only have to attempt to lose weight. So if they join this program and dropped out, we may consider them not attempting to lose weight and actually move them into the non-preferred plan the next year too. That may be an option to make sure participation that you do have skin in the game. Just a thought, because that's where our plan's currently designed.
Help with some numbers of folks that potentially could qualify based on the last biometric data that we have. So that would be. Yes, yeah.
Y'all heard me say this over and over, but it has to keep being said. We do want to look out for the employees, but we can't lose sight of the fact that we are also trying to control costs and keep the plan viable. And in doing so, we must recognize that approximately 70% of your claims that you pay out through Blue Cross involve maintenance issues. And many of those maintenance issues are key and triggered by obesity. So controlling weight, like diabetes, you can affect your A1C immediately by losing 10, 15 pounds and then more as you maintain that. I know that because I have to do that myself. And I'm not taking any shots or nothing because I'm controlling it, the diet, exercise, and so forth. So just bear that in mind. Weight loss programs, they're fun. It's good to talk about, but it's really good to make sure that the motivation, somehow the employee understands, here's why we're doing this. We want to continue to provide these benefits to you at the level we're providing them and at the cost that you're currently paying out of pocket. And if we can't control those costs, we can't continue to give you these good benefits. And the way we do that, the major way we do that, is to control chronic illness. You control that through controlling obesity at whatever level. Some of us are a little more of a challenge than others, but everyone can do that, regardless of what your weight is. It affects your health.
Any more questions on the gastric sleeve procedure, which we covered under the consultants, but it was up in, under report of mine? Any more discussion on weight loss or gastric sleeve at this time? We'll retire it until next month? Excellent. Do you have any more reports from everyone? Thank you. Do you want to just jump into your report since we're under consultant?
Sure. Alright, so I provide these every month. This is the numbers, so remember this is April numbers because we get them the month after. I don't have May yet because we're still in May. So everything, all of our numbers for this month are in the black, which means you are funding more than you're spending, which is a good thing.
Thank you.
Oh, yes. Okay, so, you're welcome. All right, so what we do track is what goes in and what comes out. So we try to keep that really straightforward, black and white. So you can see those numbers here, and the monthly change is positive for both the medical. So we did add on vision, so vision numbers are actually in these numbers now. I went back and redid all the reports from all the previous months, so vision income and outgoing is in this number. That's a small one, but so health RX vision is in the top left-hand chunk of information. We've got monthly change from year to date, and then dental is separate in that right-hand section of information. So positive change of 22,000. That is a pretty typical exchange for dental. It usually has pretty thin margins. The health RX is the one that seems to jump up and down. I'm keeping an eye on things because if you look at the chart bottom right-hand corner that has the line where we're looking at that PEPM, so it doesn't matter how many people that work at Sumner County as you grow, if you shrunk, the PEPM doesn't matter because your income and outgo would change with that. So I like the average, that's why we look at this. So you can see that it is going up from last year, which I don't like. But what we see is that you're funding it correctly because David does a great job, but also because it looks like, as I dig into the numbers, that it's actually both health and RX. For most of our clients, RX is just astronomically climbing. Some of it is what you've heard earlier with the GLP-1s. We've got some physicians, unfortunately, that are prescribing these medications with diabetes, even if their plan doesn't cover weight loss. And it's just a lot of different things. We also have people who have chronic diseases that are able to walk around and work, and they are able to live happy, healthy lives, but they take a very expensive medication. And so we see those costs. But yours does include inpatient visits as well. It's not just all drugs. So just keep that in mind. And that clinic number is that one at the bottom, and it's pretty flat, which is good. We have added large losses. I know as we get towards the end of the plan year, remember for July numbers, there will be no one on that list, hopefully. So if someone goes over $100,000, we start tracking them. 2 of these folks are terms. That means they're not on the plan anymore. We don't have to discuss why or what happened, but just note we have some of these folks that are encroaching on the $400,000 mark. That is a person that we've been tracking for several years. They usually do get kind of close to the $500,000 mark. Why is that important? The $500,000 mark is where if someone goes over that, I will take, because you have your internal stop loss, pay yourself the stop loss instead of paying Blue Cross. I'll take it out of that fund, but as of now, no one has gone over that. Because that is the level of stop loss you used to have, and you used to pay Blue Cross for. You don't anymore, you pay yourself, which is still working, but that number we do add more folks to it. One major surgery can put somebody over the $100,000 mark nowadays, so just FYI, it's not abnormal that you have that many people we're tracking in April. So, any questions on these numbers? And even if it hits you later, feel free to hit Amy up and she can get me.
I have a question.
Yes.
When I look at the light blue line on the bottom floor down here, the online side clinics, we have talked a bit about one-to-one. So their costs really remain virtually flat, and we have increased services, and they're seeing more people.
Per the financial statements that David gets, and so his office sends me, they have 2 line items. They usually have like their med, their pass-through, and then they have the other like admin costs.
Correct.
And yeah, it has remained flat if we continue to look at it that way. Do you have any? That's what you've seen as well, right?
Their cost is pretty well contained right now, especially when you start thinking about the number of employees that we're putting in there. So this is per here, so they may be actually, because we've got more employees that may be spreading some of the fixed costs.
That's what I'm thinking.
Yep.
Over time, with us and the schools, we're both growing.
What's that, the school's at like 55 people, last year, we added 20.
But
These are just you.
this is per.
Yeah, I understand, but we would average the cost of them.
So when you add back inflation, they're doing pretty well, even if they're reaching some, cost savings of other sides, you gotta think of inflation, so it seems like a pretty effective program.
Yep.
All right, I just wanted to see if I was reading that right.
One thing you may want to remember about the stop loss, if we have somebody close or reoccurring, as Brittany's pointed out, your reinsurer, a lot of times will come in and laser them out. So she's coming in, if we reach 500,000 this year and next year, she's minusing them off each year, but in reality, they probably wouldn't be covered the second year, they would have been lasered out anyway. So really, she's taking a more conservative approach, so we probably at least saved $1.3 million.
Yeah, that number is at the very, very bottom of the Ronan County Stop Loss Fund. That's how much you always paid yourself. I think 2 years ago, we did actually take money out of that fund because someone went over 500, but you're still keeping that money. It's your own savings account, your own stop loss. And he's right, they would laser, they would say, well, that individual, you know, Brittany, we're only gonna cover up to 600,000 or 750 or not at all. And so this is really, it's working to your benefit at this point. If that changes, I will let you know ASAP. But especially because right now stop loss, it's become a very chaotic market because, well, property and casualty issues around the board. So it all ties in the end.
Point being, that's a conservative estimate, it's probably more.
Yeah.
Yeah, and that fund is figured by Blue Cross. I mean, we
Yes.
still get every year, those real numbers of what you would pay if you were buying that. So we're not like upping it 2% or whatever, it's not against, it's real actuarial
Yep.
numbers.
We get a quote and evaluate it every year to see if we think it's worth your while to even consider it. And the last couple of years, we've not even brought it forward because it's very successful and the committee's not asked for it.
Yep.
But they do get the quotes every year and send them to me.
Yep. No, thank you from the county for making this decision a while back. Good one. Mr. Hyde.
I see monthly income, monthly expenses, yearly income, yearly expenses. What is our fund balance?
Jimmy, go over it.
Yeah, so if we do have an item on here for, the finance director, he's gonna go over the finances with us.
Because I don't have a report on here.
Jimmy to do that next.
Yeah, that's what I was thinking, if we wrapped up, yes, please, that seems to me.
If you could go to 72 on the screen, because it's hard to let everybody follow along when we're talking and going page 72.
Page 72 in your packet.
Page 72 in your packet. And you gotta think, these are accrual-based funds, so it means they operate like a business when transactions actually happen.
Just type 72 into it.
Just type in page number 72.
Or your scroll game is on point.
Very good.
Okay, so something to remember, we do not close these funds every month because at the end of the year, they're on an accrual basis. That means we recognize activities when they happen, but there's a time lag. So to get these out quickly, we just pretty much run them on a cash basis throughout the year. So they won't be 100% exact, but they will give you a good indicator on all the things. The first thing to answer Mr. Hyde's question, you're actually fund balance without, for some of your accruals, you've got $21.7 billion worth of cash and an estimated runoff of about $1.2 billion. It'd be a little higher now because we don't get those at the end of the year, but when you start subtracting it out, you have about $20.5 million in there. Several years ago, it was actually negative. Last year, this cash balance here was about 20.2, so you're about $1.5 million up on cash this year. Let's just scroll on down to the next slide. These are your revenues, and if you look, this is through the month of April, so about 83 1/3% of the year is gone. And a couple of things to look at, your revenues are 88.7, which is above, which is what you want to see. And your expense, even though we haven't picked up the runoff, which won't make that significant of an issue, based on the percent of the month or the percent of the year that's passed through, you're about 83 1/3% through, you're on 76.6%. So right now, in years past, we've worried about escalating costs. This year, we're not seeing quite as much pressure as we have in the prior years. We can go on now. Your dental, same thing, if we look at it, it's pretty healthy all the way around. 1.5 million in cash, about 22,000 in runoff, so you've got about 1.5 million reserves in here.
Last year, it was around 1.4, she picked up about 121,000. Let's go on that next slide. You can say the same thing, we went about 83% of the year, you're at 85.6%, so that looks really good. This one, we're at 90% at 83.3, but if you notice something that will negate a whole lot of this, if you look at your budgeted expenditures, 328,000, if you go to the earlier page, just go straight up to your budgeted revenues, they're actually 431,000. So even though we are up on expenses more than we expected, we actually budgeted significantly more revenue and expenditures. So you're overfunding this fund. So right now, go back down. This is an item to watch, but we're not really significantly concerned about the fund because we actually budgeted quite a bit of additional revenues that we picked up in this fund. Let's go on down to your next one, which is your OJI liability. It's on page number 78. Last year, this number right here was around $6.5 million, and we only adjust that at the end of the year. So you're really, that may be up or down, you're probably about $6 million. This one, you have to look at it a little different because if you notice, these are all 100%. These are the amounts paid from the highway and the general fund to fund this, but the only thing you have less is really interest earnings. But even looking at that, you're at 98%. Your interest earnings are slightly below where we want them to be, so we think we're going to be budgeting this fund. Going down to the next page, and your expenses so far always been 71%. But something to remember, this is on the job and the liability funds of these things. We haven't picked up runoff, and they can be very significant. This is a good indicator, but we'll have to get with legal at the end of the year and make estimates about these runoff funds on this. But right now, we don't have any significant concerns on any of these self-insurance funds. Anything at all look pretty far in the black. Does anybody have any questions?
Sure, my paper's much harder.
Yeah.
That's in my report. That's in my report. Unless somebody has any questions.
Commissioner Hyde, did that answer your question about how much is in our fund balances?
That's fine.
Mr.
Strong and healthy right now. Is it in a nutshell?
Historically, could you remind us how far down the fund got when you were concerned we had to infuse it?
It was,
Because we all need to keep our eye on the money.
when I first got here, they had a positive cash balance when you included the health insurance and the on-the-job injury together, but the Department of Education at that time had their non-certified employees in the health insurance, and there was a large prepayment. Before my time, it wasn't booked, but I discovered as soon as I got here, I started talking to, I think, Ms. Dursky and Mr. Shue, and tried to determine which way it went. Did they owe us money or vice versa? And as far as I can determine, it was the other way around. They had prepaid about $1.8 million. So when you take the runoff to 1.8, at the end of the day, the county commission ended up infusing about $6 million in here. The agreement was with the county commission at the time to fix it long-term, which the wellness plan's one of them, and the others to do all your premiums actuarially determined. That's why I bring you in the premium each year when we use the actuaries. They are very significantly conservative, so that's why you're picking up a lot of this. At this point, you've got a very strong fund balance, and next year I would anticipate you're going to pick up more funds unless we start decreasing the rate.
And remind the board that we did increase the medical rate this year. If you could remind us.
Yes, ma'am. You increased the health rates 5%, and it's pretty close to actuarial. The actuarial is a little skewed because it covers several, so 5% looks like based on our trends will cover it. Our dental, a couple of years back, oddly enough, I don't know if it was contracting, our claims went down, so you have had to increase in several years because you're more than the actuarial. And then in the OJI liability followed the same thing with the amount from the highway and the general fund, 5% going directly into this fund to cover claims, which looks like it'll be enough to cover it.
Thank you.
Yes, ma'am.
Any more financial questions for Mr. Long? We'll close out the financial discussion. If it's okay with the board, I'll jump back to the chairman's items. It looks like most of our other items are all risk and liability related. anybody sees anything different, just let me know. So, item 2B, the safety policy. The one thing from risk that I'd like to discuss is we saw an issue come up at one of our facilities, and it involved some police interaction. And when I asked this question of our risk managers, it's like, I wanted to make sure that all of our departments have something in place that we follow, that all of our employees are safe. In this instance, we had an employee that I don't know the full instance. I know that law enforcement was called, a patron was bothering them, and I just want to ensure that from managing risk and for safety, that all of our departments have something in place to address this. And I know that in our package, it talks about some of the safety policies of different libraries, but I'd just like to ask, do we have something in all our departments? If something was to go on anywhere, do all of our different department heads, and is that in one place, or how does that work?
To my knowledge, we do not have a specific policy for every department. I mean,
like what to do? Yeah. Because that would be something I would think that we should to mitigate any potential risk. If they know who to call, when to call, or how to, I don't know, just how does everybody else? I mean, I would just like to make a motion and direct that we do address that as a county and ask our different departments to have a plan in place to mitigate potential risks, such as the safety issue that we saw at that one facility.
Yeah, we second that.
That's pretty open and vague.
Well, I don't know
Every department does different things. I'm just plain devil's advocate here, but we gotta be careful with this committee setting policy. I think.
Oh, I don't want to set policy. I'd like to ask for risk management to work with them.
But, every department's different. That's why a lot of, and plus we've got elected officials, that's gonna be another issue, and how they create their policies. And a lot of this stuff, you're not gonna be able to create a perfect world scenario for risk management. You're gonna, just have to adjust and adapt as new things happen. Because you can't anticipate everything. Now, does something need to be in place just to get things started? I don't necessarily disagree with that, but I don't think just voting to say, hey, departments, we need to see a policy about safety. I mean, that's just way overbroad. What are you looking for? I guess
Again,
you want to be a little bit more specific.
I would just turn to risk management. I know that we haven't put a lot of focus on risk management in our county, but risk mitigation is where what pays off for us, not coming in after the fact and saying, well, we could have done it this way, or let's just see what comes up.
I would agree, it's a little bit of both, but,
So I'm just asking that we have to have a place to get started with risk mitigation. And when this item came up, where law enforcement was called in, I didn't, maybe they had a policy, and that's when I started thinking broadly that I would hope everyone has started thinking down that, and that's what risk management should be doing for us, is helping us at some point. So where do we start? I don't know, but we definitely need to start something.
what do you want her to come back to you with?
A plan, mitigating risk in different departments for the situation. Perhaps, and Mayor, I'm glad you were able to come back. Maybe you could help me address this. What I'm asking, we had a situation at one of our facilities where law enforcement was called, the employee was feeling unsafe due to a patron, and I'm just asking for risk mitigation. If all of our areas have a plan in place, if something occurs, what we're gonna do. And so, I don't know, you're over most all of those areas. So, what would you like to see? Do you want us to just go along and address it if it happens, or I'm asking to start looking for risk mitigation?
I think if you want a risk mitigation plan, that would have to come out of risk management. That's not under me.
Right. I'm talking about under you as far as a lot of the departments are under you. How that would work. Would we look for a risk mitigation plan, or do we want to just leave it to every separate individual department to not think, or
Well, I think we need an overarching plan, and we can work with the risk management, per department to develop that plan.
Excellent. I think that's what I'm asking also.
So reach out to the department and ask them.
I think that you would start creating a risk mitigation plan and work in hand with them, not telling them what to do, but just so that we have plans in place so that we're mitigating the risk. So my motion would be to ask risk management to start a risk mitigation plan. Mr. Hyde, second. Any, all in favor?
Aye.
Any opposed? So item C, under report of the chair, is temporary total disability for the sheriff's office. I know that we've talked about it, and I think this is just so that we could know where we were at with the total disability. So Kim, if you could take us through it on what we're looking at for just the details of that.
It's on 57, Cam. Should be numbered.
Okay, you actually should go back 10 years, for the sheriff's office temporary total disability that was paid. So I have broken it out, and if you look on the third page, we paid out $239,762.21 in temporary total disability for these employees for those 10 years. That's what risk management pays, which is 66 2/3% of their average weekly wage for 52 weeks prior to their injury. So, and then, of course, the sheriff's office is making up the difference. I don't know what the difference was. I don't have any access to their full payroll, but the sheriff's office made up the difference. This is what risk management paid. $222,000. I had to break it out into two separate categories because I always lump the settlement amount in with the temporary total disability. It's just what we've always done. So I had to break that out. So the $222,265 was settlement for those employees, for those state employees for that 10-year period. So the temporary total disability was the $239 that they were paid from risk management.
Thank you. I think this all came up in our OJI discussion. I don't think there was any action, but if any of the board had continual questions.
As far as the settlement total, I guess total to date paid, and then comp, settlement part right there, what are you saying?
When an employee has a significant enough injury, the doctor will assess an impairment rating, and our plan specifies that when they have an impairment rating, we have a settlement that we have to offer them. So there's a formula that I use to come up with a settlement amount, and that's what those totals came out to be.
Okay, so are you saying, I still don't really
So can you walk us
understand.
through the first line,
Yeah.
what it means exactly?
The very first individual.
Yeah,
Yeah.
just so we can have an example.
So the
of what it
total amount of comp / settlement that they were paid is $12,893.
They got that amount of money.
Total altogether. The $4,222.48 was a settlement that they were offered. They had an impairment rating to their whole person.
So that was a lump sum?
So that, well, we offered in two different ways. We offered as a lump sum or biweekly. If they choose the biweekly, they get the full 100% settlement amount. If they choose a lump sum, we discount it by 60%.
Okay.
But I don't know which one they chose,
Okay.
just by looking at their spreadsheet. I don't remember that person, what they chose.
Yeah.
But a few of them have chose lump sum, so, we saved a little bit there as far as total payout, but that was their settlement.
But then the
That
total-
was their agreed settlement
Yeah.
amount.
But then the total, today paid, I don't understand what that, if we've already paid them this, then
What do we,
Well, when they're on temporary total disability,
temporary total disability?
they're not able to work. So when they're not able to work, I had to pay them their.
I think the number you're looking for is add those two together, and that's the total amount that was paid for that employee.
The first column was the total.
The comp paid is their total, what I paid them, but I had to break it out into their settlement versus their temporary total disability. In my system, I lumped it together instead of listing it separately, their settlement amount, if they got one. So I had to go through and break them out.
So the TDY paid was what was paid until we settled with them.
Yes, that's why they were out of work. Temporary total disability is while they were out of work.
How do you determine the legitimacy of these claims? I was just noticing some like contracted COVID while at the jail. How would you determine that? I mean, that's like sometimes a day or 2 days delay.
Yeah.
And it could have been at home, in church, or.
That was hard during that period of time. We didn't know exactly how COVID came about. It was, so legal came to me and they said, we're going, especially the ones in the jail where the inmates or the corrections officers and the sheriff's office employees were dealing with the inmates and the arrestees. The legal came to me and said, we're going to have to cover this because we're not sure exactly how this is happening. So we took those, and most of those are sheriff's employees, the COVID claim.
And my question is, how you determine that?
We really, at that time, we really didn't. We were doing a lot. I mean, that was just a hard time. So I don't know that we really had a good answer at that particular moment.
This is the same time the county rented a hotel
Yeah.
for paramedics and jailers and deputies if they contracted COVID and they had family members at home that were particularly susceptible to it, that we actually housed them to keep them from contaminating other individuals. And then we claimed it back to FEMA.
Yeah, I was just mentioning that it's COVID because there was such a delay. How would you determine, hey, this was at church, not at work, this was?
We really didn't have a good answer.
That's the same way on now.
And then item G, occupational injuries for the past 5 years. Can you address that for us? And again, I think that's just follow up from our previous discussion.
I broke it out. I pulled from July 1, 21 through the current date of the date I ran this report. And it broke it out into the department and the body part and how many we had of each. Is that the information that you wanted? Is that what you wanted to see?
I think the question at prior meetings has been like, people just wondering what the injuries were, and that was just kind of open-ended, and we asked that you bring back and just let us know what they were. And Mr. Hyde, I think to your COVID question, page 63 does outline a lot of COVID issues. 62, starting at 62 and 63.
Yeah, I'm just wondering how, my question generally was just, who determines if it's an occupational injury?
Do you have a time limit? If I fall and hurt myself, do I have 24 hours to contact you?
We're supposed to report it within 24 hours to a supervisor or someone of that nature, and it has to be on paper to us within 7 days. That's our policy at the current time.
So there's a 7-day lag before you enter its management. Is that common, or would people not just call you directly?
No, it's more common for them to fill out the injury report and report it within the 24 hours. We have a one department who likes to let their employees report it to the office, and if something comes of it, then they'll put it on paper, but they're told it has to be just within 7 days.
That seems like a long time before you know.
Well, I mean, that's just what our policy, previously, it was 30 days.
Wow.
So when we developed our new plan, we cut it back to 7, but trying to help with some of the situations. 24-hour period came in because we had a lot of people reporting Monday morning injuries that we knew happened over the weekend, but they reported it after they came to work. So that's how we cut that by making it a 24-hour reporting period. It's supposed to be reported immediately, but our policy says within 24 hours.
But there's two different policies I'm hearing. There's the policy to let their department head or some supervisor know, and then there's a policy to let you know, which is 7 days.
Well, I mean, that's what our policy currently states. To a supervisor within 24 hours, but it has to be on paper to us within 7 days before it can be considered. Now, most of the time, we do get it within the 24 hours, but I'm saying it can happen. They do have that leeway.
Is there any reason they don't just contact you?
We need to have some sort of documentation and chain of command in the loop. So that there's gonna be, my recommendation is to always have some sort of, immediate higher up notified as it moves its way towards Kim. Because if they just come straight to Kim, then Kim's gotta turn around in case their supervisor doesn't know. They may have to do shift changes. It could be ECC, it could be Sheriff's Department. I mean, there's a whole bunch of, missed opportunities to fill whatever gap you need to. So that's why I think that gap is in there, is to make sure that their front line is aware of it as it's coming to Kim.
And so then we're giving the front line 7 days to contact.
24 hours
20.
with a follow-up in writing in 7 days.
Okay, so they're going to call you in 24 hours.
They're supposed to, yes.
The supervisor of the employee.
The department supervisor, lead, whatever they're called, they normally contact us within 24 hours.
Now, writing doesn't have to be on paper, the email, right?
We have a form, yeah, an injury report, it's the form that we use. That has to be to us within 7 days.
Can we deny that?
I have to, because that's outside of my office authority. I will have to get authorization to accept it after that.
I think I've only been asked for it once, and that was a truly unique situation, but, it kicks up from her to me after that.
I was just curious, how it works in the discussion. Any more questions on the occupational injuries? So we have covered item 3, the financials. We've covered the report of the consultant. We have before us still the executive session and then old business. Mr. Lawyer, are you prepared for the executive session at this time, or do we?
I am, unless y'all want to push it to the end. I hate to keep anybody here any longer than they need to be.
Will it affect anything of the old business if we go through it, or the new business?
I don't think it'll interfere with me. We can go to the bathroom.
Very good. We'll hold executive session at the end, and that will release you guys for your day. I don't know how long. We have no old business under our old business item. We'll move into new business insurance. Analysis of the county's insurance bid, page 82. So we have a couple of different people that are involved in our bid. Mr. Long, if you could tell us which different people, how the bid process works for the board, just briefly.
Mr. Sheep provides us the actual bid specs, then we just bid it out to the actual bidders or the public. We receive them back, we give him a copy, he evaluates them, and then they come back to the board. At this point, you guys will look at them based on what you see, recommend the best lowest, and then we'll move forward with the contracting phase.
Very good.
Just to make sure, I did the insurance bid, actually RFP, but the EMA,
I'll discuss that.
I didn't touch that.
We bid that about 3 years ago, and I'll discuss that.
Okay.
You're just item one.
Right. This is a simple one, would rather it not have been this simple, but we only got 2 submissions from the current vendor. We got a notification from another vendor who works with another county client of ours that they went out to every market that they would approach, and every single market had already been approached, and that means in the property and casualty world, that market is blocked. So like if a broker goes to insurance company A, B, and C and requests quotes from them, and they're licensed to do business in this state, then those insurance companies give that broker the quote, and nobody else can get a quote. This is legal. This is how business is done in the commercial insurance market and the property and casualty side. And the health side, they'll give quotes to anybody that shows up with a license. But in the property and casualty side, once they give one, they don't give one to anybody else. So we have no idea how many quotes were gotten. They don't have to tell us this. No laws are broken. Everything was done on, like, according to the plan that is laid out in the law.
I know about the background of this, but answer this for me. It can, if they are not, if they have not been requested to submit a bid, can any insurance company still do this?
That's just how they do it. It's 2 private entities doing business with each other, and it's kind of difficult to regulate that. It's just how the industry has chosen to operate for decades. So we have basically a renewal, and then the option 2 actually presented you with your SIR and your liability being cut in half from $1 million down to $500,000. But option 2, although submitted with a pollution and a deadly weapon policy, does not actually contain those policies, because the carrier for those 2 policies, well, first of all, the pollution, you got in with Allianz years ago, and you've been paying premium to this company for years, and so they just continue to give you a very good rate. If you were to go to another company, you're going to pay a lot more for that pollution policy. This is from the broker. So essentially, if you go option 2, you're not going to have any pollution coverage. Whether that's not something that you get hit with very often, it's not a coverage that needs to be robust per se, because the way you do business, you're not really a polluter of sorts. You don't have vats of coal ash sitting out somewhere. That's other industries altogether. But the deadly weapon one, they said they could get another quote. They didn't submit it with the proposal, but it's going to be more expensive as well. So you would have to, I don't know what legal would say about it, but in order to accept option 2, you essentially would have to do some, I guess, reject the bids or something to call, because there was nothing submitted.
Do we have that now?
We have an option 1, and then option.
If we had a deadly weapons issue today, we probably.
You're currently covered, yes.
So our current policy, I believe that's what you're asking, Mr. White.
Yeah, you're currently covered.
Okay.
So if you choose option 2, then a whole lot of stuff is going to happen in order to get all your coverages put back together.
Well, this actually makes it very simple, because we vote yes or no to renew.
Right. It's not technically a renewal, but it is the renewal. And
well,
also another point, the property values used by both of these companies was their own. I jumped on his desk and told him and showed him reports. This is how we get these numbers. Where are you getting your numbers from? And they said, well, their people just said that this is the way they thought it should be insured. Like, for instance, option 2, which is Hanover, said that they were going to take the value reported on your new courthouse from $100 million down to $85 million. Why? Because they didn't think it was worth $100 million. Even though you literally just spent $100 million on this building, they didn't think it was. So your current policy, they didn't use the numbers we gave as well. So their numbers, apparently, when you sign up for this renewal, the premiums that are quoted on the last page back here will go down a little bit. because ours, they use these numbers.
Okay,
Mr. Bell?
with that $85 million, is that saying that is the replacement cost? That's
No.
what they would,
You still have blanket coverage, so essentially, if you had $1 billion worth of stuff, you have $1 billion worth of coverage. Kind of. Because your current policy is a $200 million per occurrence limit, which means you get, if that courthouse gets destroyed, there's technically $200 million to replace it. Not that you're gonna need it, but there is. Did you have something?
It has to be described properly, though. That's the most important thing. It has to be the right square footage, type of building.
just to get, we had, some jewelry that was appraised. And then our insurance company said, okay, we will go with your appraisal, but we will pay what, it is gonna cost to replace it exactly by that description on the appraisal.
Right, that's called valuation. So your policy is on a replacement cost valuation, so they would replace it at what it would cost to replace it now. Now, the historical buildings are not replacement, functional replacement costs, because it's hard to get, old oak beams for these old buildings. So they would replace it with something that works just like an old oak beam, and maybe even try to make it look like one, but it's not an old oak beam, which would cost hundreds of thousands of dollars.
So to sum it up, if the building's described properly, it's under the blanket. So if it's insured for 85 or 100 million and it's destroyed, unless there's $200 million worth of property destroyed, it really doesn't have an impact on us, correct?
Technically, no. But the option 2 that is asking to do that is also only $125 million per occurrence limit. If you lower it to 85, then they'll go $150 million per occurrance limit.
But you said we didn't bid it per option 2. We bid it per option 1.
We didn't technically bid it, if we're using terminology correctly. It was an RFP.
It's sealed and sent out as a sealed bid RFP.
Okay, well, RFP is the language used all throughout the document.
Requests for proposal.
Yeah.
But it's still a sealed RFP. So
Right.
It's a sealed bid.
Every client I have, every client I have addresses that specific thing differently. So I have to let you guys know.
RFP is request for proposal. RFQ is request for qualifications. Right. We wanted actual proposals, so it was an RFP, it was a sealed bid.
Right.
Just a real life experience, and what Jeremy's saying is the way we figure the value of your buildings is to physically go there and verify that all the data is correct. Building construction type, and so forth and so on. Square footage, checked out, measured, has there been any additions to the building, and so forth. To just come up with a number, that might work under this type of insurance, but in a real life situation, sometimes in a municipality what happens is a building gets substantially damaged, and the entity decides, well, we're going to rebuild it, but we're going to rebuild it on the other side of town. We're just going to tear that one down. So give us that big check, and we'll put that in the bank to use to build this in another location. And the insurance company will come back and tell you, that's not how this works. If you want to just walk away with the check, that amount is going to be what it will cost us, the insurance company, to put it back like it was before it was destroyed. If we're going to build it somewhere else, we have no evaluation to figure that out. So we're going to make the evaluation on what you have there. So in this case, if you're round numbers 85 million or 100 million, you get an $85 million check to go on the other side of town and rebuild the facility with your 85, when in fact that plus increased cost of construction and everything else, you're going to be short. It's vitally important that you insure your buildings and structures for what industry standards that are updated by zip code, construction material, labor, the whole thing, because that's constantly fluctuating at a given time each year, which is what we provide. Insurance companies, as Jeremy described, decided, no, we don't want to do that. Why? Insurance is rated on a rate per thousand coverage. That's the standard that's used. So, makes your premium appear cheaper in a competitive issue, that becomes pretty good. It can turn into a game. I've been doing this for close to 40 years, and I wish it weren't true, but it is. But it's why we've developed how we handle our clients' business. So that's important to us. And the other thing is, I'll leave it.
So we're not getting replacement costs.
Essentially, they looked at the per square foot cost and thought it was too high, and they proposed a lower per square foot cost. So when I gave them a report showing, well, this is how much the roof cost, this is how much the HVAC cost, this is how much the walls cost, the broker was like, I sent that on to him, and that's a very good amount of information, and hopefully we'll get that, sorted, but it didn't get sorted. But he did say, once you elect to go with one of them, that they will work to get the schedule correct, as reported to them.
And I never thought I would agree with insurance companies, but I can see some idea that they have here, in that there are certain infrastructure factors that would be there regardless of that placement, like all of your plumbing and a lot of the ground engineering and pavement and many things that would have, that were part of that 100 million that would be there regard. I mean, just theoretically, I could see some rationale there.
I just have a couple items I'd like to clarify. So we have before us option A and B is, just to restate, B is incomplete because it doesn't have what we really need in some areas. Without
There's
getting
two
into
coverages you don't have in option B. You'd have to, yes, in addition.
And we are again this year up against the timeline because our policy expires July 1st. I'd like to remind everyone, we're again at the point we have to make a decision. We have option A then in front of us. When you talk about the values, we've talked specifically about the courthouse. You've mentioned in the past, I know that last year we talked about it was just slapped with $100 million and that's the value. But then we insured it for how much?
105.
105 million. So now you've mentioned someone else that said 85 million. What, in option A here, which is our only whole option before us today, what are we insuring just that one courthouse for?
Again, it's a blanket policy.
It's a blanket policy.
Everything you have is your total limit. It's your per occurrence limit where you turn into a limit.
Okay.
So, like one storm takes out 2 buildings,
then we're
you have $200 million for that whole storm. Not just, you don't get 200 per building. So if you, like the courthouse sitting next to another building, say that's $300 million worth of building, it's actually only $200 million of coverage. You don't have that problem. The courthouse is the majority of your buildings.
So I guess the question is, what was the courthouse's value for valuation of this policy?
Yes, thank you.
Well, it's going to be what we reported to them.
Which is what?
Which is $105 million.
Okay. I think that's the ultimate question.
Right. That number was derived from me talking with the actual architects, engineers, and sitting down and because I just kept gouging him because I'm still not getting this number you're coming up with. And he said, oh, we got this and this and this. And I was like, okay, that's part of it. All right, yes. So the number is correct.
I have an unrelated question. As far as these two bids go, do we have any prior acts issues we need to be concerned about as far as picking up the policy, lawsuit timelines, as far as you were talking about the, what was the weapons thing, for example?
The deadly weapons coverage.
Yeah, just using that as an example, if there's some claim made for acts that were prior to the inception of this policy. So if we are going with option 1, which is a renewal, right?
Correct.
So everything's covered anyway,
Yeah,
right?
you're already set. The only way that would be a problem is if you were switching insurance companies, and we'd have to make sure all of your
And
retro
that's not
dates.
in fact happening.
Yeah, that's not.
That's not an option
That's-
because we were closed, everybody else was closed out.
That's fine, that's was my only concern.
Yeah, and the reason for the deadly weapon policy not being available in option 2 is that Allianz, which I think is it's Lloyd's, but it's still Allianz, I think. They required the Liberty Mutual property in order to sell you the deadly weapon, which negates it from option 2.
I move to accept this bid, Madam Chair.
Can I, insert one more question before we move forward? How much, I mean, we have no other choice.
Yeah.
I'll have to go with it.
We're,
How much did our insurance go up? Because that's,
Well, it went up, like, from what was proposed, it went up about 2%, which is fantastic. However you cut it, that's great. But they said when they do the property schedule realignment that that number may go down some. So you might have actually,
I thought we should find out.
You
how much
might
it costs
save-
before we approve it.
right, but we.
I don't wanna
didn't
quote a
get-
number.
We didn't get anything on the table to move forward anyway, so.
Right.
I know,
I make a motion to accept.
This is including brokerage fees, correct?
and I'll second
yeah,
that.
I asked about that, and they said that
Included in the total?
commissions are all included,
Okay.
which was another, yeah, that was so apparently when you let the broker go, that changed the agreement, so they're all commissions now.
It's in that total,
Yeah,
69 some odd thousand.
but nowhere did I see a reference in any proposal of a $50,000 broker fee, so it's likely all commissions now.
But it's already in that number.
Yeah.
We have a motion and a second to go with option 1, which covers all of our needs and is a 2% increase. Can I get a vote on that? All in favor?
Aye.
Aye.
Can you say approximately, that way we don't have?
Yeah, we don't know what that number's gonna be. It's not gonna be a huge shift, but we can't quote an actual number yet.
So the total price is on page 97. So I've been going through here and I've been seeing a lot of.
It looks like that minus 14.
Yeah, well, there it is. Right
Yeah.
there.
It's on the screen.
Yeah, right there.
Yay, thank you.
Trying to find what the final subtotal, total.
So the one on the right there, the 851 is, from what my record shows, your current. That could be a little off, up or down. But then the 869 is basically a renewal.
You think it may go down a little bit, but not up?
It may, but I wouldn't wanna say it's gonna be less than you paid last year. I don't wanna make that number.
But this number's not gonna be any more than what we're showing on here.
No, it should not be.
I'm asking for budgeting.
Yeah, there's no reason that I've been given so far that that number should go up.
So we have a motion and a second. All in favor?
Aye.
Any opposed? Motion passes. We have a increase policy. So in the future meetings, I'd like to discuss, what other options might look like if we were to, I've been looking at some other counties, they actually went out and bid their broker. In this case, our broker was selected for us because they closed the market. We could look at what broker we want, we could stay with our broker, we could go with the state pool, which, has its pros and cons also, but this board could look into different options.
That you would probably need to do next year.
Yes, in the future, we're covered for the next 12 months.
Yeah.
But there are other options. So, Mr. Long, you're gonna pick up the EMA insurance package, you tell us.
These are the quotes that they sent to risk management, but we actually had a 3-year bid with this particular, policy, and it actually had, $250 deductibles, which is only one of the options, so the other options wasn't even within the bid. So at this point, because we're not to June, and if this doesn't qualify under the bid, it will have to be bid. So I would recommend you, put this off to next month to actually consider, because we'll go back in purchasing, we're looking at it right now, to see if we think it complies to the actual bid. And we need to discuss it with the vendor a little closer.
This is their additional,
This-
or whenever they have their volunteers and all that kind of stuff.
This is the quote they gave to risk management. We bid this generally every year. Back in, a couple years back, we did a 3-year bid. so he sent three options. We know some of these options aren't within the bid. We think the first one is, but we need to talk to him closer to make sure of those details. Make sure we're on the same page before we move forward with anything.
So I know that we discussed this, EMA had the policy that we discussed about 6 months ago regarding their workers' comp, and we pulled our county employees off that workers' comp piece. And that's not in here. Did we go with that with a 6 months to get it aligned with everything else?
And that's the next page, is Berkeley, halfway, that's the workers' comp piece.
Page 99.
Those premiums are not included in this first page.
That's what I.
It's a separate policy.
And is it by the same broker?
Yes.
It looks like right now we may want to consider just rebidding the whole thing, because we got 60 days before now in June. We made changes. Well, first we need to see if this one still falls in line with the bid to bring it back to you, and this change here. If it doesn't, then we're really going to need to rebid it, because we're talking $44,000 of purchases, well over the bid limit.
So I have a question. So we pulled out of the workers' comp piece the the county employees and they're just covered on what volunteers only. So now I want to ask you back to the other policy then. We're putting some automobiles under this policy. I would have thought we would have been self-insuring them with all our other county automobiles. Can you address that?
He has automobile coverage because he has volunteers driving those vehicles. So we need the
Covering
coverage because it's a department-owned vehicle, but we have volunteers driving them.
I see what you're saying. So it's just it's covering their liability.
Yes.
We cover that, like, for my own car insurance. I can have liability, I can have collision, I can have, what do we get with this? Do we have all kinds of things, or, I know I'm not speaking in insurance term words. Do I just have liability? So I'm a volunteer and I come in and I drive.
It's like, as if you got a policy for a car.
So is it a full policy?
Yes.
Like it covers all?
Yes.
Yes.
Comprehensive?
Yes.
It fixes your vehicle.
Yes.
And does it fix somebody else's?
That's a liability.
That would be
That's a liability,
liability.
it fixes theirs, and anybody that has a fatality, it covers that, or it does.
Property damage, which is the auto. And then you got the package on top.
And just as, the building insurance policy was gone through, and it was found that it didn't cover deadly weapons and stuff, will you be going through this automobile policy to make sure that we're covered? And like, I know, and you can come and tell me that if there's a fatality, this is gonna cover it.
Yes, I will.
You'll do that, and just like.
I signed upstairs, I just don't remember all the clauses.
I understand. I just wanna make sure we have all of that.
Probably need to have a meeting in June, late, to determine, before this expires, determine when this one complies, or if we need to rebid it over the next month.
Yeah, and when you say expire, we're talking about the renewal provision, right?
July 1.
Yeah.
To have something awarded before July 1.
We'll have a meeting with you,
I think
and you'll be back with a recommendation.
wait, June. Well, we're gonna evaluate it to the bid, and if it doesn't comply with the bid, then we'll go back and bid it again. Because right now, the current bid, it has the $250 deductible. Some of the other options, option 1 and 2, does not appear to. So it looks like option 3, but I'm a little at a loss of how that's working, but.
Yeah, if you
We need to
give
talk
us
to him
this slide
closer.
and analyze what we're getting, and.
We need more details on his quote.
So we'll, move that to old business for next month, and we'll be meeting in June. I'm saying June, does anyone, have preference? Should we try for the third Tuesday and just see if we can make that happen, or
That'd be the 17th.
is that what we've been doing, third Tuesday?
Thursday.
Thursday?
That's what they, no, that's fine for me, it is Tuesday,
That would just
yeah.
be a little over 2 weeks from now. Is there any way you could do it?
Yeah, we can do
The
whatever.
30th is actually the same day as commission. You do it the day of that on the 30th of June. Gives plenty of time to get it bid and back out.
Works for me. We can aim for it. That gives you 5 weeks.
Evaluate it today.
But then, does this one not expire July 1st, or July 30th? June 30th. So we won't have time then.
You're correct.
That's not working.
Could you do the 26th maybe?
But even if you're gonna come back and say we need to rebid it, we don't have time.
Well, what we'll do is if it doesn't comply, we know we're gonna have to bid it, so we'll
So
go.
you're just gonna start the bid process.
Go ahead.
You're gonna go to your office and determine
Go ahead
that.
and bid. If it meets the bid, then really, it's gotta be the one in here that meets the bid specs, or we've gotta rebid it anyway.
Yeah, we're talking about a window for renewal, we're not
Right,
talking about
I know.
the end of the policy.
So if you
When
need to
you
bid,
have to
you'll get a
renew
bid before.
I thought you said it was 60 days.
No, 60 days.
No, I thought you said there was a 60-day window, and that's what you were shooting for.
No. It has, this policy's July 1, so we'll wanna go back and talk to the broker to see the details on this, so it complies with the bid. So what we do today is what, the 27th? So if he does not comply with that bid, then we need enough time to bid it back out and come back before so she's correct. We can't necessarily renew it on June 30, for June 30, so we probably need 1, 2 weeks. I mean, it's gonna be tight.
Mm-hmm.
And I'm not here the week of the 27th. So, kind of one of those deals. How about, can we shoot for the 20th or the 19th? That's Juneteenth for close.
Yep.
So if we look at it today, we get it out to the street. We gotta get it in the paper.
When is this one up?
July 1st is what you're saying.
Of this year or next year? I thought we were only in year,
We're,
finishing year 2 of
that's my questions came back. We're in year 3 of the bid, but if he didn't comply with the bid, we're gonna need to go back and read.
And I understand that.
If he did,
Until we get answers to that, we've still got a year on this.
If he complies with it, then we still got a year. He's got a valid bid right now.
That's what's throwing me.
Right.
So can we do this? Can you, let us know if you need us to call a meeting in June? You determine, you do your work this week, and you let us know. You let us know when those work, and we will all try at least to make a quorum and get 3 others here for whatever we need to do to get this done.
Right, we'll try to do it this probably week right here.
Does that work for the board?
We'll email you where we're at on it. If it is the existing bid, we probably are just gonna have to go with it anyway. Cause we got a valid.
Get back to us.
Do we need to make some kind of decision here as to which option to go, since it does have all these deductibles?
We went and looked at the bid upstairs and it didn't have those choices on that. It was like $250, so we're going back and we're gonna talk to the broker. Cause he just quoted these to Miss White. He didn't actually.
And I believe these were sent out as an opportunity to discuss changes that could be implemented for a reduction in rate, is that right?
Yeah.
So, I really think this was premature, this was meant to make decisions for the future.
So really what you're doing, if you come back and you change those, then that's not what he bid, we can't use what he's bid. And the question is.
This is what they bid, right?
No, that's what he just quoted.
Throwing some options out.
He threw some options, right, he threw options to you, and we wanna see, this right here meets what we think you've currently got, but we don't know all the details, so we don't know if that meets those bid specs anymore or not. We need the details from him, and we need to evaluate it over the next day or two. These are just quotes, so, but it needs to be done before July 1. So, bring
So,
back.
yeah, if you could just get back to us in the next week on what you want us to do, we'll have a meeting to discuss your findings, or if you find that it's good that we're good under this year's 3-year policy, and we can discuss this for future.
How about if the committee could, if it complies with the bid specs, because we've already got a valid bid for us to move on forward with it. If it does not, then we'll move on forward with the bid and then try to get you the stuff back the last week in June as close as we can.
A motion?
He's gonna need it to move forward if
Yeah.
it needs it.
Then we'll bring you the bid back either way.
Does everyone understand this? Do y'all understand what he's asking us for?
I do, but it wouldn't matter if we did or not.
You may repeat it again.
No, I understand.
Yes, I'll make that motion. I could get a second?
So,
All in favor?
Aye.
Any opposed? Next item, update on deeds for county property.
That's these two books, the law director's, assistant and I work together, she pulls the deeds and we put them in the book.
Excellent.
Everything's labeled, but what we currently have with the three lists combined. My list, register of deeds list, and the, finance director's list. So
They're available upstairs.
everything's gonna be in the law director's office.
Excellent.
Is that what you wanted?
Yes, I think that that's appropriate for our county to have a books with a list of deeds from our property. Were you able to, I mean, we've had discussions along the way, different properties. Were you able to, find all the answers you were seeking?
To my knowledge, yes.
If we don't know about it, we don't know about it, yeah.
That I don't know about yet, but yes. We tried to.
So you mentioned the, your list, finance director's list, and the
Register of deeds.
and the registry of deeds. And does the assessor's office have a different list? They should not, they should match to the deeds list, but.
Yeah, I did include a list from them. They sent us over to the register of deeds to get a list, so that's where we went.
Okay, because I think one day they gave me a list, but, I don't know. And again, it felt like a puzzle of what we didn't know along the way.
Combining those three, that's what we have in this book.
So, and I know some other people weren't here, some of the property, they had to do research because we didn't know we owned it. Some of it went back and forth. We owned it, we don't own it, we own it, we don't own it. And as far as we wanted to only insure what we did own. And while I'm on that, insuring what we did own, I sent, Mr. Sittler an email yesterday. My concern, I think I did, it may have went to my draft, if I didn't get to go.
I'm still playing catch up on emails.
No worries, I do too. Insuring property that we have county insurance on, we have discussed this before, and I think I've discussed it with you, if we have, another policy, and I think this came from when we were discussing the EMA workers' comp, we didn't want two different insurance companies insuring the same thing. So one of the things that have come up at the libraries, they're wanting to have additional insurance if we have an outside group come in. So I want to discuss if we have two insurance policies on the same thing, what's going to happen. We have our county insurance, and then if we're asking other groups to insure our room, if they were to come in here and rent this room, let's say that's not happening. But if we required them to have insurance in here, then we'd have two insurance companies. My concern is who's going to pay if we have two insurance companies.
Are you talking about like if somebody uses a room and we're added as additional insured?
Yeah, that's what they're going to do at the library.
That would be two standalone issues, and our insurance company would try to get the other one to pay first, is how I've seen it happen in the past, and then based on what happens out of that.
And I think that's what we discussed with the EMA, with the workers' comp, and it's the reason we pulled our employees out of that, so we don't have one insurance policy. I'm just asking if that's a problem.
If you have two policies, you will have one that is primary and then one that comes out and when that one runs out. So
Do we have to designate?
You brought up several different issues in one statement. One is the libraries. We ran into this with Hendersonville, and the outcome of that is what has sent this deed into a tailspin, is the coverage, the way it was being reported, became an audit issue. And David knows better than I do how that went down, but so insurance is very significant in how we do this when it comes to county-owned property, especially when the cities are involved.
And I understand that. I'm just asking, since we're here, and we're talking about insurance, and we're talking about multiple policies, how that's going to look. And I guess my question right here was, do we have to designate who's the primary?
I don't think you get to make that call.
Yeah, you don't get to make that choice. It becomes a subrogation battle later.
A battle. That sounds expensive.
I don't think, why on earth would we want two insurance companies?
The only time I see it as being even practical is, for example, Shackle Island Volunteer Fire Department. They rent a building from us. I believe as part of their room rental is that you have to have a policy in play and that the county or the volunteer fire department be named as additional insured in that policy. That's when I see these things come into play in the normal legal arena. I don't see the need for anybody to be paying two separate policies for the same piece of property. That I have not seen an example where that would make sense.
Would it be, because you know more about it than I do, but could we just say that that our board strongly suggests or directs that there be no additional insurance policies unless their need is presented to us, like that need with the
I would say any additional insurance is pending the approval of SIB. Yeah, that would be
I put that
well
part
within your
of the
purview.
The key term here is insurable risk. For you to insure something, you have to have what the industry calls an insurable risk. Or if there's a loss to what you're insuring, you have a risk of losing something. So that way, no one can insure. I can't insure your house. I can give you some money, but I can't insure it because if there's a loss to that, I didn't lose anything. Okay? So you can't, like the county fire department renting a space from our volunteer fire department, right? Renting space from the county. If that building burns to the ground, the volunteer fire department loses a place to park the truck, but they didn't lose anything. So that building needs to be insured by the owner of that only. However, the people renting it need insurance for what they own in it and their liability for allowing someone on the premises of your building, because that can get into dual suits, but both could be sued. The county could be sued, and the renter could be sued. So both need, but they are totally different kinds of policies.
Yeah.
There's a lessor policy and on and on. But the insurance language would take care of that. And most underwriting departments, when somebody sells your policy, that's going to go back to some underwriter. They're going to question that. And they're going to come, I'm sorry, you can't insure this.
Right.
You don't know.
I see that this could be opening a door where we have all kinds of people wanting duplicate kinds of insurance all over the county. So I make a motion, Madam Chair, that we...
Before we make that motion, if I can interject one thing, so you all aren't drug into every little aspect of what goes on day to day. We do collect certificates of insurance for event-related stuff. I don't think you all need to be drug into that because Mr. White's already got a process involved for collecting that. It's much like renter's insurance that he's discussing, where when they use a facility or they're in the county building because of an event or it's some sort of use, allowed use at the county, let them have the building. Now, what's an example?
If somebody has an event on one of our properties, they're supposed to purchase the special event insurance and send us a certificate of insurance showing that they have added us to their coverage.
So we just need to say, if it's lessor or renter's insurance, that's what needs to be brought for us.
They just need to provide us.
Or event.
Well, now, event, you said we didn't need, that's just a.
Oh, yeah, I'm sorry, yes.
I'm just saying, renter or lessor.
Yes.
That's all we need, yeah, that's all we need, so just put that in there.
I'll make that in the form of a motion.
I'm still not clear. Do we have a lot of these?
I guess, yeah.
So, again, back to Mr. Strittler, what is an example of some of these events that we do this with?
Well, I mean, it's everything for like vendors who come onto our property and do work.
So
They
that's
have to
like,
provide us.
they have insurance, yes, I
Yes,
understand
they
that
have
they would.
they have to provide us a certificate of insurance.
Yes, like the guy that climbs up on the roof.
Yeah, roofers,
But that sounds different to
HVAC
me.
people, I mean, it's just all kinds of different things.
But it's outside of a lessor-lessee relationship, so it would.
What do we have in the lessor, like, and that, Mr. Shoemaker, his comments brought up a question for me, like at Shackle Island, but we have other facilities that we have volunteer, usage of. Do we have these lessee type of agreements with them? If out there at Oak Grove, we have volunteers that are in there, do they have like this renter, leasee,
I can't tell you off the top of my head, but who owns that one?
We own that
Who owns
building,
that property? Then it's covered under our insurance.
but then it goes back to it's covered under us, I see that, but they're not our employees, so do we need what Mr. Shute was talking about, like an agreement that they cover their own liability for their volunteers in addition to us, or I don't know, I'm just asking.
Well, they do have their own insurance, I do know that, because y'all have.
So they do have their own, but they don't give that to you.
No, but if something were to happen, I know I go to them, and I say, or they, say for instance, at, Shackle Island, one of the volunteers backed into the bay door. They called me, they said, this happened, and I said, okay, their insurance paid for the repairs. I just had to make sure that that was all taken care of. Things like that. Does that make sense?
It makes sense, I'm just wondering,
I just,
I guess it's kind of like the deed thing, it seems like this is out there and it's happening, but we should know it's happening, but we don't have documentation, or we should know that they have it.
To pull it back to the library question, the start of the conversation, you have people coming into the library, right, that are not employees. This is what we're talking about, correct? So they're layering coverage is what they're doing. So you have a liability policy, but you're going to go after them for their liability policy first, but because they're a person and not an entity, their limits are probably not going to be high enough. So they're going to exhaust their coverage, and then you're going to step in on top of them and pay. Now, what we need to do is we need to sit down with the libraries who are asking for these policies, because they obviously that they don't know if they're covered. This is probably coming from fear. There may be coverage for it. So this is where the broker could come in and sit down and say, what is it that you're worried about happening? This is where it's already covered, or this is how we can fill that gap that you're worried about. So before you make any motions, I would suggest that you ask your broker to sit down with this librarian and go over what exactly the problem is.
I think my motion would be in the realm of, we should not introduce any more policies on insurance from agencies within the government unless they first approach this board, and then if him or the lawyer or anyone else says this is not necessary, we shouldn't do this, it would give us an opportunity to. So that's my motion, that they should come to this board before they demand any other thing, and it may be good, right, but it's just a formality.
I would strongly urge you to get the broker to put his words on paper as to what is and what is not.
I do like that also, getting things documented.
Because this may already be covered. It may be a non-issue altogether.
Well, and that would give us the opportunity by directing it back to us to do what we needed to do.
So I'd like to make an amendment to your motion. I'd like to also include a list, because I feel uncertain about how widespread this is. I don't know Shackle Island, I don't know library, I don't know all the places that this is a thing. Kim, you said there's different, I'm not interested in the workers' compensation or the workers' insurance. The people that, a repairman that come, I'm not interested in their liability insurance. But how many of these events, I didn't know about Shackle Island, I just found out about the library, I don't know if there are others, so, if I could amend I'd like them to come back, but I'd also like us to get a full list of where all of our potential risk is at. That you think that these people have insurance policies, is that, do you understand? Do you think that they have them at Shackle Island?
Yes.
And do you think they have them at Oak
That's a
Grove?
property damage situation. When
Not
they have
like falling
when
down?
they have events, I don't know that they get event insurance.
Can you put some time and thought into
You
trying
might want
to?
to bust this up, because one's probably gonna end up being a resolution, and this is just a directive for.
I'll withdraw my amendment and I'll second Mr. Hyde's motion that all things come through this insurance board. So we have a motion and a second, all in favor?
Aye.
Any opposed? So if we could just start putting our arms around it, and I think a list would help get us in that direction, and then people coming to this board so we can see what is out there.
I would hope that our chairperson would approach, the libraries and explain to them that they need to approach us with what they're wanting to do insurance-wise, since we have such a responsibility that way.
I'd recommend it be a library board ask, not a
Okay.
specific library ask.
But that's correct, right?
Like everything else, if legal could send over a notice that that's what's come out of the insurance board to let them know. I think that's. All right, any more questions on, update on these? Thank you, Kim, for doing all that work. I want to say that is a tremendous amount of work. And I know it wasn't just you. I mean, you did a line share, but you had a lot of people helping you. And that is fantastic that you've done that. Thank you. Occupational injury payments, the liability stuff. Kim, do you want to go through? Everybody has questions and stuff.
3 months, February, March, and April, that we have in the packet. And if you have any questions on any of those, that's what we paid in those 3 months.
I have a question. Corbell, if I'm saying that right, is that, do we contract with them and is that a bid? We bid that out? I think I've asked you this before, I just forgotten.
They're a processing company. They process the claims for us.
Is that a professional service or a bid?
I think we did it several years ago, but we've been
Initially,
using them since.
when we started using bill review services several years ago, we bid it out, but
Can you just look at that and make sure we're in compliance with?
We can look at it again, but changing it would be
I just want to make sure we're
just like
following the rules.
just like software or, just like our clinics. Once we do a bid, we usually stick with those for several years because it's very difficult to change.
If you're going to do something with the Corbell, I would recommend you do it together if you're going to bid the broker, because that's something that another house may be able to do inside, in-house processing. There's TPAs, like you mentioned Rutherford County before.
Yes.
They actually have a TPA that pays their claims and does all
Can
this
you
stuff,
tell us
and then
what
has a
TPA
broker,
is? 'Cause I'm
a
not
third-party administrator. You're basically the administrator, but you're first party because it's yours. If you hired someone to pay claims, that would be a third-party administrator.
It's like Blue Cross and your medical.
Right. They're just paying
They're not
claims.
insuring you, but they're processing and determining what claims should be paid, how they should be paid.
Right.
And processing the claim.
In Rutherford County, their broker that they've
They did it.
hired,
Yeah.
there's what, are they doing this type of processing also?
I can't get into the specifics of that program. I haven't looked at it in a minute, but yeah, their TPA is also their broker and also like their risk management resource. Like they just kind of are the one-stop shop. So they're probably doing that as well. It's a work comp. They're just repricing and that sort of stuff, right? Yeah. So everybody's got their own ways of doing things and navigating. But I wouldn't go out and bid Corbell separate from the broker. Even if you do select two different things, put it all together so that it's a cohesive. When we get done with this, we want someone to just take this every year and make it do what we tell it to do, as opposed to having.
At Rutherford County, they have more of a built-out staff for risk management, and they're doing a lot more mitigation stuff.
They're also much larger, because
They're much larger.
the school system is involved.
Yes, they're much
$2.5
larger.
billion of property.
And they keep it all under finance, and they report, they're reporting a lot more in their open meetings, in their full meetings and stuff.
Yeah, just because there's so many eyes looking at, when you get that big, it's,
Yeah.
everybody's watching, so.
Yeah, if our fund is at 20 million for our healthcare, imagine where theirs is with their schooling and stuff. It's a big.
We can go back and look at it again. Got some questions here, page 106. High value, high dollar. Very first one there, after the Board of Education, $13,420 for bill review. What is that?
Get to that page.
So we can start there.
Yeah, that's what Corbell does.
There's about 4 of them on here that
If we had a very, very large hospital bill, and that's what his was, it was a very large hospital bill, and we didn't pay, we got a very large cut, they cut off a lot of it, and it's gonna be a larger, bill review, let's see if I can find it.
Is that a percentage of savings?
Yes. 20% of the savings is what we pay. And I think his hospital bill came in at over like $100,000, but we didn't pay.
I think we need to split the two together.
Because he had his surgery at Hendersonville Medical Center, and they charge a lot more than some of these surgery centers. So we got a very large reduction, and when we get a large reduction, we have to pay a large bill review fee.
What about the next one down at 9,202 for ops?
Outpatient, that was the surgery.
Outpatient, okay.
That was the surgery.
Okay. And then, I guess, same thing down at clerical, 8,000, and 6,500, what did you say for prescription?
Yes, she has, not responded, this is a very difficult case, where she has not responded to normal antibiotics. So they have to go out and do a special kind of,
It's a compounded medication, yeah.
Compounded medication.
Making it.
And
They have to make it.
she has to have that every 6 weeks. So. And believe me, they've tried everything, because this has been going on for over 1.5 years.
Thank you.
The next item is in-house vehicle repair. I know we've brought this up, Mr. Hodge, you've been very attuned to how many cars are we wrecking. We've talked about that, and we asked Ms. White to bring back for us some ideas so we could see how that's going.
And I broke down the 2 departments with the most vehicles, EMS and Sheriff's Office. You got a description of what kinds of incidents they're having versus the amount paid is what we paid out to another party in property damage, and the in-house cost is what it costs to either repair it in-house or what they paid to a body shop to repair.
The in-house seems wide.
Well, I mean,
Like, if you look at the first one, and I'm just asking how it reads, I guess, ambulance backed into a pole. There was no amount paid out and no in-house cost. We're not leaving that ambulance running around with a dent in it. Somebody fixed it.
sometimes it don't do it. I mean, it's an ambulance, so they're built very heavy. So it don't, maybe it gets scuff on it, you know, if it just gets scuff on it, they just report it to me. So, and I keep everything. So everything that came into me is what's on this report, regardless of the severity of it.
So like, item on January the 10th, ambulance slid on icy road and struck a vehicle. Our in-house cost is $500. We struck a vehicle. I assume then our insurance paid out, so it's not
I
on here.
just now got the vehicle repaired for the other party, and it's $20,000.
So that, at some point, that would fall into this, like if we wanted to look at amount paid.
I just didn't get it in time.
We're just not,
to
okay,
get it on
yet. I see, okay.
These are in-house repair of our vehicles, correct? it doesn't count for where we hit other vehicles.
No, the amount paid.
So I'm saying, you're only looking at our vehicles, not the other ones that we run into. So if a patrol car hits another car and we have to pay for it, that's not.
That's in our insurance. Or,
Well,
Not necessarily.
I pay for it out of my.
Yeah, usually not, unless it's very large. No, it's not in these totals, so these are, I think what you're wanting to see is in-house and out-of-house payments that we made.
I was just wondering,
That's what this is.
I think the
That's just
conversation,
it
I
covers
know
other
it says
vehicles,
in-house, but it's what the sheriff's office or what the EMS department pays.
including getting other vehicles.
Well, that's what the amount we pay, the amount paid. I maybe didn't title my column.
Oh, okay, so these are that low.
The amount paid is the amount that I paid to the other party for their property damage or vehicle damage or whatever. And maybe I should have clarified that better, but that's what I put on.
So that's other payment, okay.
so I think the conversation before was, we talked about risk in this, and the history was in the past, we had identified people for training, and that didn't really pay off, and we spent a lot of money, we didn't really see any really good returns, so now it just, y'all can stop me, but now we just, people hit people, and we pay, or we don't pay, but there's no controls over it, or we just, I mean, are we reassessing to retrain people on driving or anything?
That would be a departmental setup, and as far as I know, there's no remediation to any of this. I do believe at some point in time, this county had a committee for reviewing accidents, but
Accident review board.
And could you speak to, I know that you and I spoke to it, could you speak to the board about our lawsuits that we have, that we do have lawsuits and costs associated with accidents?
well, executive session will bring up one of those.
Excellent. So there is a cost that we are incurring that we're not really seeing on the paper here that we're gonna get to. And so I'm just suggesting that we find a way to, possibly plan in the future to look at, we can take that up at another time.
I'd like to ask the attorney a question. Several years ago, when one of our local county judges had a family member that was injured at an intersection by an ambulance, or killed, I think, by an ambulance, there was a policy developed, and I don't know if it was with the EMS or with this board, that the ambulances would, like, blow their air horn and going through major intersections where the traffic light was against them. I have on 2 different occasions, noticed that this was not done. How liable would we be if there is a policy, and we struck someone, injured them, damaged their automobile, or whatever?
That too is the subject of our executive session.
Oh.
So, to answer your question, if it's a deviation from policy, it's a high risk situation.
And then along that same line, but a little bit different, it's been brought to my attention that we've had a policy in the past that all county vehicles need to have the symbol on them and clearly marked that they belong to Sumner County. And perhaps we're not as diligent at getting that done. One, I'd like to know what the policy is and how long we have between people getting it done and what's the process of ensuring that. Because I want the citizens to know if it's our vehicle.
Needs to be for tax issues too. It's not undercover.
Mr. Long talked with the tax issues, yes, tax issues.
And we do have a policy out to go find it. It's gotta be clearly marked, it's not with the tag. It's gotta be basically an undercover vehicle.
And I have asked some county employees, and they told me they just haven't gotten around to it yet. Now, we didn't clarify. I told them they said they were gonna get right on it. But, yeah, if we could discuss that in the future.
I believe it's on the finance website, a copy of a memo from me about addressing it for taxes.
Okay, so we'll move to vision insurance, Mr. Long.
And I think it's got an email from Brittany, but the issue we've come up with is Blue Cross Blue Shield did not inform us that they've made some changes in our network on the vision. So, for instance, there's not any vision carriers covered under our insurance right now in Gallatin. We're very late in the year, and your vision is actually embedded in with your, for better word, we're self-insured on the vision, but it's, Blue Cross Blue Shield processes the payments. So it's part of our actual health. She's put down a couple of options, but we're so late in the year, I think probably the best action would be just to leave it as is at this point. I'll let you be aware of it and look at it for next year.
Okay, yeah, because you can always bid it.
But
Next year.
Right.
But for July 1, it's
really close, and
but next year you can bid it.
But for the coming year, the July 1 year, I think you probably just need to leave it as is. It's going to be very confusing to change it this late hour.
So that just means that they have to go to Hendersonville for eye care?
Hendersonville or somewhere else is covered.
Can you just,
I know there's some
send out an email and let everybody know, or are they just finding out at the?
If we got anything from Blue Cross, you can send an email.
Yeah, I'm sure they get
Just find out when we go.
Can you
I
send
know, I'd like to.
There's a
surprise
link.
for you.
Yeah.
There is
to
a
the network.
to find the network before you
Right.
go. Walmart is included, but when they did that, that dropped people who were associated with the, I'll probably say it wrong, the Acuity Network. And the folks in Gallatin, which seem to be the ones that I was asked about, are part of the Acuity, so they got excluded.
The one inside of Walmart is.
Yeah, and so,
It's really confusing.
which I will be honest, vision and dental networks can sometimes be confusing in general, but yeah, we can always fit it next year. You say, I didn't know any of the, I wasn't over vision.
We wasn't aware.
We weren't notified.
Yeah, you didn't know.
We weren't notified as
Yeah.
employers.
So I just make a motion that benefits sends out an email to all the employees saying that we're trying to get this.
I think the best thing is to say, please look at your network.
Yes.
And I think there's a link to the network.
So they can't go to Walmart for glasses?
They can go to Walmart.
But
They
just
can't,
be
so there's a,
optometrist inside Walmart.
I associate, there's,
Yeah,
yeah.
they can't go to the optometrist.
They can't go there, but
They can buy your glasses there.
they can still go to Walmart for lenses and
But
stuff.
they're out of our network, kind of.
The way I understood it is that Walmart actually is involved now, but it's that another carrier in Gallatin that a lot of folks were using, they're not
The
now.
actual eye doctors in Gallatin, none of them are accepted anymore.
You need to ask questions before you go. You should do that anyway, even on health or dental. You should make sure they're in network.
They give us the link for the network, so it'd probably be easiest for us to send to all the department heads and ask them, let their employees be aware.
Yep.
There's been changes in the network, this is the link, please provide it to your employees, and then put the memorandum on our website like all the rest of them we've got. We'll go ahead and take care of it, there's no need for a motion.
Thank you. Mr. Schmidt, do you have more questions about the meeting?
No.
Okay, excellent. And that brings us to, we will just have executive session last, and thank you. I'd like to come back into session after our executive session. Mr. Sittler?
Yeah, what we're voting on is executive session. Item number one, if we could, Madam Chairman, if you could call for a vote on, giving me approval to move forward or not.
So, if we could vote, aye for approving and nay for not approving. I'll take the vote. All in favor?
Do we need to mention it or not?
No.
Okay.
So again, an aye will be approval and a nay will be disapproving his authority to go forward.
And move it to commission.
And moving to commission. All in favor?
Aye.
Any opposed? Mr. Lawyer, if you can move this item forward to commission. Thank you. And that concludes our meeting for today, and we are adjourned.